Hi, I'm Natalie Imbruglia, and I have a very important message to share with you, and one that I hold dear to my heart. Right now, significant numbers of women and adolescent girls across the world are enduring lives of misery, shunned by their husbands and families because of a largely treatable condition: obstetric fistula. Obstetric fistula is an injury to a woman's body during a difficult, long labour, which often lasts many days, and where an emergency caesarean section is delayed or simply not possible. The injury is disfiguring, it's devastating, and it's life-shattering. As well as causing a fistula, the prolonged labour also tragically leads to a stillborn baby in more than 90% of cases. A fistula can cause women and girls to become incontinent and to leak urine and fecal matter uncontrollably. The unrelenting odour stemming from this condition frequently causes affected women to be abandoned by their husbands and exiled from their communities. Condemned by their society as unclean, many suffer the misery of fistula with virtually no chance of companionship or support. In Ethiopia, a shy girl named Tegest married, became pregnant, and endured labour for 5 full days. Her baby did not survive. During the labour, she developed a fistula, and her husband left her, unable to endure the smell that her medical condition had caused. There are an estimated 2 million women like Tegest, young and older, whose bodies have been injured by difficult deliveries. Fistula isn't a condition you may want to think of or talk about, but unless we all agree to do something about it, these women will continue to be invisible, with no hope. No hope at all. Here's the good news. Preventing and correcting fistula is in most cases possible. The condition is almost entirely preventable when women have access to reproductive health care and supplies, voluntary family planning, skilled birth attendants, and emergency obstetric care when complications arise. And for the women presently suffering with fistula, a surgical operation, one that costs just $400 per patient, can in most cases treat the injury and restore a woman's continence and dignity. Just $10 will help feed a recovering fistula patient for 2 weeks, and $60 pays for a caesarean section to prevent the problem. Sadly, most women with a fistula don't know that restoring their bodies, their lives, and their dignity might be just one medical procedure away. Those who do know are often simply not able to afford the surgery. Can you imagine the intense suffering and shame of being a social outcast? The unending misery of feeling helpless for even just a few moments? The foul odour that causes others to avoid you? The humiliation, deprivation, and despair are fierce and unending. The campaign to end fistula is present in 55 countries across the world, working on prevention, treatment, and rehabilitation. Donate now to help make fistula as rare in the developing countries as it is in the developed world. Help stop the needless suffering of women and girls living with one of the most dreadful childbirth injuries. You can help prevent fistula from occurring in the first place. And for all those suffering from this devastating condition, you can help deliver hope and health to restore and transform their lives. End the shame. End the isolation. End fistula.